Well, thank you, Mr. Chairman and ranking member. I missed sitting beside you, by the way. Those were some good hearings we had back in the day. But it's good to be here this morning. And I come from the business world. I was in business. Still, my wife in business now. I tell people all I own is a Tahoe and a member of Congress. But yeah, I served because I was involved in health care. I was chairman of a hospital board for 9 years. I was asked to serve on the Healthy Future Task Force. And I'll tell you, what I learned is this government is driving up the cost of health care because the government is driving health care. Even the private sector has joined forces with the government. They're all in it together. I challenge my colleagues, you talk about anger and vitriol. Go to an emergency room on a Friday or a Saturday night. Get out in your districts, see what's going on. You will see anger and vitriol like you've never seen it before. And I personally feel empathetic to those providers that have to sit there and put up with what these people are throwing at them, and then they have to take care of them. And unfortunately, that's where our country is. In fact, what I found in this process, in talking to, we talked to hundreds and hundreds of professionals, patients, you name it, to try to get to some solution here. Nobody's happy in health care. Nobody. The patients aren't happy. The providers aren't happy. And let me tell you, you talk to the American Medical Association, we are experiencing a severe shortage in providers. That's not going to be good for any of us. And so I ask the question, why? It's because this government is in charge of your health care. We have only a government health care system. That's it. All the privates, all the hospitals have got on board and are following it right down the road. So, like I said, I come from the business world. And what I would like to ask Mr. White is this. Obviously, the only way to bring down costs is competition. Right now, the only people that have a waiver, and our state's been trying to get waivers to drive down costs in our state of Georgia. And we got waivers from the Trump administration, and they were all taken away under the Biden administration. We were driving down cost with these waivers. The only people that get waivers now are unions and the faith-based communities, and thank goodness for the faith-based communities because they have some programs that are reducing costs for families of faith. We have to have a private system in this country to compete with the government system. That will keep government accountable and competitive, because right now it is the wild, wild west, and it's unsustainable. Mr. White, what are your recommendations?
Yeah, I think you highlighted the problem excellently. I think the fallacy is that people think that we have free market health care in the United States. We don't.
No.
We have 93% of all health markets are highly concentrated. That means they lack competition for services, providers, doctors, hospitals, et cetera. And in those markets, consumers pay much higher prices. And one of the reasons is we have a lack of enforcement from government bureaucrats and agencies. But the other reason is that we really have done a poor job explaining what free market health coverage is. And I think you're starting to take some of those steps here today to talk about competition, letting people band together to get big pools to negotiate lower rates. Look, Costco and Amazon can negotiate a lower price because they're really big.
You give the business community a waiver, they'll fix health care in this country. Quality will go up, providers will come back because they don't have to deal with the force of this federal and the oppression of this federal government.
And Congressman, may I say one more thing? 50 cents of every dollar spent in healthcare comes from Washington, D.C.
Yeah.
And every entity in healthcare is regulated at some level, local, state, federal, by regulations.
Yeah.
And so they're constrained in what they can do and offer.
Yeah,
What
and-
we're talking about today is flexing that up
Yeah.
just a little bit.
Yeah, and I got to add one thing. I asked the question to every one of these professionals, can you break down the cost of health care for me? Peel the onion. That way I can figure out where the money's going. Not a single one of them can do it. And with that, Mr. Chairman, I yield back, and that's the only way we're going to get to the bottom of this, because somebody is on the take here. Thank you.